Hello, hello. My name is Jennifer Udom, and this is Dope Stethoscope. It is my biweekly podcast where culture and clinical medicine meet. The aim of this whole podcast is going to be at giving the general public medical knowledge that might be very rudimentary or normal for your average practitioner, but this makes it a little bit more entertaining, a little bit more interactive. You can leave comments, I'll try to answer the questions. And so, the whole aim of this podcast is to let the general public know about what's going on in medicine and give a few generalized tips about how to move forward in your own everyday life. Um, Disclaimer, I am a resident at a North Carolina residency. This is not sponsored by my residency, nor does my residency endorse any of the topics that I talk about here. And my standard medical advice to anybody in an emergency or even outside of an emergency is to seek your own local practitioner if you need to, okay? This is not a substitute for medical advice. It's just the entertaining podcast that might give you a few tidbits that you might not have otherwise have known about. Please excuse any background noise. I'm filming today in the library, so that's why I'm also a little muted compared to how I normally am. But you can tell from my eyeshadow and my blouse that I'm really an outgoing personality. So we'll remedy that on the next episode. But for now, I'm going to be a little bit quiet so we can discuss this topic. And it might be appropriate to discuss this topic in this tone and tenor because it's something that is very taboo for a lot of people to discuss. The topic for today is sex, sexual health, and prevention of STIs. So I'll start off by telling a little anecdote. Jen did that, so hopefully you won't have to go through that. So I'll be sharing a lot of embarrassing things about myself. I'm going to give my mom time to leave the room. Okay. And all of these anecdotes are aimed at making you feel less nervous or shy about your own general health. Never be afraid to talk to your medical practitioner about what's going on with you. An ounce of prevention is worth a pound of cure. So go see your own doctor regularly, and definitely if you need to. But I went to see my doctor, this was about 6 years ago, about a general checkup. I was just getting a physical, and they asked me all the things they ask you when you go to the doctor. How often do you sleep? You have any chronic medical issues? You take any medications? And then they got to the sexual history. And so I won't tell you anything about what's going on now out of respect for my current partner, but I was a righteous and self-righteous virgin at that time, okay? So when she asked me about my sexual history, I was like, ma'am, I don't know about the vaginal doors of your other clientele, but this one right here, it's lock solid. Ain't nothing going up in here. I'm good. I don't need a pap smear. I don't need a vaginal exam. I'm straight. And she asked me, she goes, are you a virgin? And I said, of course I am, you know. I know, don't flame me. I'm just sharing, okay? So I said, of course I am. She said, okay, but do you engage in sexual activity? And I was like, doesn't virgin mean that you don't indulge in sexual activity? So I felt like I'd answered her question. But then she clarified. She says, is there anybody, man or woman, who sexual organs you touch at all, or who touch your sexual organs at all? And that includes your mouth, your vagina, another penis. And she broke it down for me. And then I started thinking to all the times my then boyfriend got past second base, not all the way home, but you know, petting and this and that. And then all of a sudden, I realized that even if I wasn't having sexual intercourse, I was sexually active. And there is a difference. So I'm going to get graphic, but this is all for the purposes of education, entertainment and education, but also education. And yes, I'm getting nervous because we don't normally talk about these things candidly, but we will. We're still getting to know each other. Okay, so fondling, kissing, oral sex of any kind, any pairing, anal sex, and vaginal intercourse are all sexual activity. And you need to be protecting yourself regardless of which kind that you actually indulge in. And so just because you're not having vaginal intercourse doesn't mean that you're not engaged in sexual activity. So when we think about social media and the movies, they always get right to it. Where there's some wine and there's some candles and some soft music. A lot of times what there isn't is a dental dam, a condom, or some other mode of contraception. So we're going to discuss that. One of the big things that I've discussed with some of my younger clientele or patients is oral sex and the need for protection during. So just to be clear, you can have STIs in your mouth and throat. I know. And so the best thing to do would be to use a condom or a dental dam. And for those of you who don't know what a dental dam is, I haven't seen it referred to in media, but it is a square sheet that resembles saran wrap that you would place over usually the vagina before you put your mouth on it to make sure that you're not having skin-to-skin contact. I know, it sounds like a lot, but it is a modality to protect yourself against STIs. And so if you're having protected sex, then using a condom or dental dam during is probably a safer bet than just putting your plain old mouth on any willy or punani that you don't know, okay? And before all of that even happens, you and your partner should have a candid discussion about sexual practices and get tested, preferably together, so you can swap results right then and make sure that everyone's clean. And if you do, then that might make you feel better about having unprotected sex, which I'm not endorsing because there's still that 9-month curse or blessing, depending on how you see it, called pregnancy that can happen whether you catch an STI or not. So get tested with your partner, and whether you do or don't, I would suggest protection, but if not, if you're not going to get tested, you should probably be using some sort of barrier method. So what do STIs look like? A lot of you probably hear a lot of propaganda about there being a lot of itching, burning, discharge, and all of that is true. It can happen, but sometimes the vagina or penis in question looks completely normal, pristine, okay? And the only way you would know is to get tested. STIs like herpes is particularly hard to test for. We have tests, but they're not good tests. And so a lot of times a person comes to us with a bump below the belt, asking us what it is. Is it an ingrown hair? Is it a scrape? It's herpes. And there's not a good way to test for it. We kind of know it when we see it, and you don't want to get to the point where we're telling you we see it. So herpes is particularly interesting. I'm going to take a little time with it because it can be passed when a person is completely asymptomatic. A lot of people have what we call outbursts, or outbreaks rather, not an outburst. That's when you yell out, sorry. Outbreaks of herpes or little incidents of herpes. And they have periods of time where they don't have an outbreak at all. When they have the outbreak, it manifests in like little bumps, what we call vesicles, and little openings also, sores on your vagina or penis. So when they're not having an outbreak, a person's outside genitals can look completely normal. And the disease has a phase called shedding, where though there's no visible outbreak, meaning you can't see any bumps or bruises on the vagina or penis, they are still shedding the virus. So they are still actively replicating that virus. And you can catch it by engaging in sexual activity, not just sex, but sexual activity, touching, licking, sucking, all of the above. And you can actually catch herpes while the person does not have an outbreak. So just because you don't see anything doesn't mean it's not there. Okay? It's the where in the world is Carmen Sandiego of STIs. It just pops up and then it ghosts. Okay? Excuse my nails, they're not done. But that just proves that it's very important to get testing and very important to use protection even when everything seems completely normal. Okay? So one of the new things in social media and television that's been showing up is Truvada. Truvada is what we call PrEP, pre-exposure prophylaxis. So how do I break that down for you? If you're engaging in what they deem as risky sexual behavior, not routinely using condoms, multiple sexual partners, having sex for food or room and board, prostitution, you are having high-risk sex. And I know a lot of you heard the having sex for room and board prostitution, but mind you, I started with using condoms inconsistently. That's also high-risk sexual behavior. And so if you are in that category, you can take something called PrEP. PrEP is pre-exposure prophylaxis, like I said before, and all that means, that's fancy terminology for saying, I don't have HIV. I want to take a medicine that's going to decrease my chances of catching it because I know I'm engaging in risky sexual behavior. It's like the morning before pill, not the morning after pill. You take this before. So if you want to take PrEP, you have to get tested for HIV because, you got to make sure you don't have it in the first place. And PrEP is actually part of the therapy that people take when they do have HIV. So if you take it beforehand, it can act not quite like a vaccine, but it can act to lower your chances of actually catching HIV. And this is called Truvada. That is the brand name. I believe it's emtricitabine tenofovir. Say that 3 times fast. Okay? So you can take that, and then it drastically lowers your chances of catching HIV. And it's been tested and study proven and actually been out for a while, but I've just recently started seeing commercials about this. And you can ask your own primary care provider about it if you have more questions about whether or not you're eligible or if it's something that you might benefit from. The world that we live in, it seems like everybody should be taking it, but talk to your primary care physician and see if it actually is correct for you, okay? So what are the consequences of unsafe sex? STIs, right? Some that we cannot get rid of. like HIV. And even HIV is becoming a lot more easily treatable. A lot of people can take like a once a day pill. I'm not saying you should run through everybody in your sorority or fraternity, local fraternity or sorority, just because we have these medicines. But, you know, for those of you who might be suffering from this HIV, know that it's not a death sentence. There are things you can take regularly to help preserve your life and help you live actually up to a normal lifespan, whereas 20 years ago that might not have been the case. Certainly not 40 years ago. Okay, so no stigma here. We're just trying to, prevent the cases that we can prevent. But HIV, it's not just the virus itself, it's what it does to your immune system. So people with HIV can have lung issues, they can have kidney issues, brain issues, and I won't go into all the logistics. God forbid that you ever need to actually know that information, but it can happen. So there are a lot of things other than just catching HIV. You don't just lose limbs one by one. It's not leprosy. If it's treated well, you can live a fairly normal life, but if not, there can be lots of complications down the road. Also, STIs. I was talking to one of my friends a long time ago. This was college, so for me, that's like almost 10 years. I know, black don't crack, relax. But I was talking to one of my friends about STIs, and I was like, keep messing around, you're gonna pick up something you ain't put down. And they were like, syphilis is curable. And I was like, okay. I don't think me and that friend still talk, like minds and whatnot, because I did not like that comment. Syphilis is curable. It is, but come on. So are things like gonorrhea and chlamydia. But some of the side effects from them are not necessarily. So, PID, pelvic inflammatory disease, I won't go too much into it, but to break it down for you, you catch something like gonorrhea or chlamydia, you don't get tested frequently, you let it kind of simmer and brew, and then by the time you take care of it, your doctor can give you antibiotics because it's curable. But it can inflame, for my females, your fallopian tubes to the point where you may become infertile afterwards. Ipso facto, you might not be able to get pregnant because of the damage that the STI actually does to your system, your female reproductive system. So that's another issue. Outside of weeks or days of itching and burning, it can cause long-lasting issues with fertility. So you got to look into that and make sure that you get tested regularly if you're having sex. And then pregnancy, that's 18 years. Hard time. Sorry for the parents out there. I mean, I'm sure it's a beautiful thing, but usually if you're expecting it or if you're in either a relationship or a situation where you're prepared to handle the side effects. I personally don't have daycare money, but to each their own, I don't speak for everybody. So we've talked about what is sex, what is sexual activity. So sexual activity is anything involving a sexual orifice, including your mouth, your genitals, penis or vagina, penis and vagina, vagina and vagina, penis and penis. STIs can be spread in all of those modalities. So FYI, no offense, but all, my homosexual couples who think that, okay, we might just, rub up against each other. You're at risk also. And I think lesbian couples are also at increased risk for bacterial vaginosis, which is a bacterial infection because of all of the exchange and secretion. So there are risks to every type of sex, including sex that's not penis and vagina, and including oral sex. You can catch STIs in your mouth and throat, okay, including herpes and others. So, what do we use for protection? We have dental dams, we have condoms, and if you feel like that takes the sexy out of your sexual interactions, know that you're taking a risk, but you can decrease some of that risk by getting tested with your partner. Again, things like herpes, we have tests, but they're not great tests. So there's still a large element of risk. And I think they say 1 in 3 people has genital herpes. And if you can ever think of a time where somebody asked you to fill a survey out and you didn't fill it, then you know that that number is probably higher than we think. So that's always a risk. And then also things like herpes and other STIs, the person doesn't always have green goo coming out from their penis or vagina. Sometimes it looks completely normal and they're still brewing an infection, especially with herpes, where we have what we call the shedding period, like we discussed, where a person is just replicating that virus, but there are no outward symptoms. So keep that in mind. We talked about Truvada, pre-exposure prophylaxis or PrEP, and you can take Truvada. Your PCP, OB, or whoever prescribes it to you will test to make sure you don't already have HIV. And then you'll probably get tested every month afterwards, just to make sure you've not procured the infection, because it is not a cure for HIV and it's not a vaccine for HIV. It's just a medicine that lowers your chance of getting HIV with some people who have been shown to have high-risk sexual behaviors. Okay, so if 100 people were having unsafe sex and 50 got HIV off of Truvada, then maybe taking Truvada would lower that number to 25 or 30 out of 100 instead of 50. So it just decreases your chances, but it's not a vaccine, it's not a free pass, and it's not a cure. Okay, so there's Truvada for people engaged in high-risk sexual activities. And again, high-risk sexual activities include, as defined by them, sex for food or shelter, and inconsistent condom use. So that could be anybody. You don't have to be a prostitute to qualify for Truvada, nor do you have to be I see a lot of marketing towards the LGBTQ community. You don't have to be part of the LGBTQ community either. You don't have to be having homosexual sex to qualify for Truvada. And then we discussed the consequences of unsafe sex. So there are STIs, many of which have lasting effects. Even the curable ones like gonorrhea and chlamydia can lead to issues with fertility down the road, or just chronic infections, because once you have had an STI, you're at higher risk for getting one in the future, including HIV. And so you just increase your risk there for future STIs. And pregnancy. 18 years of raising a child, blessing, cursed, you decide. I guess it depends on your circumstances, or at least the pain of childbirth, even if you decide to give it up, the social, emotional, and physical trauma of childbirth, or, I don't know, the $50 investment in the morning after pill. Either way, it's expensive. I don't have the extra money. Maybe you do. But if you don't, then protect yourself. So, in closing, this has been the inaugural episode of Dope Stethoscope, Sexual Health and Staying Prepared. I have a podcast. This is the first episode of the podcast, but I also have a blog called Dope Stethoscope. The website is dopesteth, dopesteth.com, dopesteth.com. And you can also read my blog post, which has some of the same information if you just want to read and refer. And some other cool little, blogs about my experience in medical school residency and some other controversial health issues. Okay? So hopefully I said prescribe. I'm thinking about myself. You may or may not be a doctor like me. Hopefully you subscribe to my channel, Dope Stethoscope, on YouTube. And we'll see you next time. We'll be talking about vaping. Okay? Stay blessed.